Hey everyone, welcome back to Static Cardiology on EMTV. I'll be giving you an ECG rhythm and a scenario. On the bottom of the screen, you'll see a timer for 1 minute and 30 seconds. This time closely resembles the actual amount of time you'll want to be spending on each card during a National Registry exam. When the time is up, I'll be giving you an answer as well as a treatment. Good luck.
3, 2, 1.
So let's not waste any time. Let's go ahead and take a look at that strip in closer detail and see if we can't identify this rhythm. First thing I like to do with any strip is find out how fast this is going. So let's go ahead and count out those R waves. I'm counting 18 R waves, which means this rate is approximately 180 BPM. Next thing we'll do is examine the QRS complex. It's fairly narrow. I'll then look at the P wave, and for this particular rhythm there's no real difference between a P or a T wave. It's just kind of morphed together into one big amalgamous wave. And then even though there is a little bit of baseline wander, likely due to patient movement or breathing, the R to R interval here is very consistent. Because of this criteria, my diagnosis of rhythm is going to be supraventricular tachycardia, or SVT. Let's go ahead and take a look at the scenario now. So we're dispatched to a private residence for a 42-year-old female who suddenly collapsed after riding her exercise bike. You find the patient on the ground confused and profusely diaphoretic. You feel a rapid, weak, carotid pulse and see a small amount of vomit around her mouth. There's a teenage son there, and when asked what happened, he states that he heard his mother fall after getting off the bike and found her on the floor. Your partner obtains the following vital signs: blood pressure 70/36, pulse 185, respiratory rate 18, SpO2 96% on room air, and blood sugar of 100. Physical exam reveals no other acute findings. Now, as the vast majority of your points in static cardiology are scored by actually correct treatment, you have to first determine if this patient is stable or unstable so you can choose which side of the ACLS algorithm you want to follow. Now, for my unstable patients, I use the acronym CHAD. And this of course stands for cardiac insufficiency, hypotension, alteration of mental status, and dyspnea. Based on my patient's current vital signs and physical presentation, her BP is 70, she's confused, she's definitely an unstable patient. So my final diagnosis for static cardiology is going to be an unstable SVT. Now let's go ahead and take a look at the treatment. Now, just like with all my other static cardiology cards, I'll begin my treatment by regurgitating the mantra, scene safe, BSI, IV, O2, monitor. Part of the airway management of this patient may involve also suctioning the airway, making sure it's clear of vomitus. Now remember, this patient is unstable, and the old saying goes, unstable gets the cables. So my primary treatment for this patient is actually going to involve energy delivery. For this particular patient, she's going to benefit the most from synchronized cardioversion. So to do that, I will consider sedation, I'll attach the pads, and I'll press sync on the monitor. I'll then select my energy, starting at 100 joules. I'll charge my device, and then I'll press and hold to deliver the shock. I'll repeat this as necessary up to a maximum of 360 joules. I could then consider IV fluids, and then I'll finish up the card by saying rapid transport. And that's it. If you like this video, please make sure to subscribe to my channel for more static cardiology. And remember, you can make your own custom playlists using my cards to help you study with for your National Registry exams. Until I see you next, have a good rest of your night.